Yes, and record for the rest who may have wanted to join, but it's in the middle of the workday. So we understand, we understand. So thank you so much for making the time to join today's CME. The focus for today's CME will be POCUS, which is Point of Care Ultrasound Training, specifically probe use. Now, the probe is supposed to replace the stethoscope. However, the POCUS probe is a bit expensive, but has many advantages over the traditional stethoscope, and it also has a variety of uses. Now, before we start, I'll just mention a few things. I know that no doubt we have had all these things before, but I request that you please bear with us. So quality care is in partnership with a company called Global Ultrasound Institute, or GASI in short, which is over here in the back. Actually, nice to say is that we've just finished a point of care ultrasound training just a few minutes ago. So personally, I strongly believe that POCUS is the future of medicine, in the sense that using the probe, using point of care ultrasound training makes the whole experience of trying to find out what's happening inside of your patient easier, more effective, faster. So POCUS has many advantages. For those who don't know, my name is Edgar. I'm the admin here at Quality Care. My role is to make sure that all of these trainings, the CMEs, etc., happen in an effective manner. For the purposes of today's CME, we'll have Edna. Edna is an AHA instructor. She's a POCUS instructor. She's an ICU instructor. And she also works in the ICU. So she has a wealth of knowledge in the subject. This is where we're based. This is where all our trainings in Nairobi take place. We do travel a lot. We were recently in Kerugoya. Before that, we were in Embu. Before that, Nanyuki, etc. So we are based in Nairobi, but wherever you are here in this country, we can come and train, provided you do have a quorum of at least 10 students, will come and train. And of course, the Life is Why campaign is still near and dear to our hearts. We hope that all of us have been spreading this gospel of high quality CPR, and we hope that we are able to improve survivorship from cardiac arrest in this country. So this was the previous CME. This is the current one. We have POCUS training. The next POCUS will be next month. Also, something I should mention is that we will have the ICU training next week. ICU training is specifically targeted to medical officers. If you're a medical officer and you work in the ICU, very important to do this course. Reason for this is because we realize that management of critical patients is lacking a bit. Yes, and you can also use your POCUS in the ICU. So here we have the mechanical vent. We do look at that in the ICU. Here we have the POCUS probe. Specifically here, we were using, I believe this is the Philips Lumify probe. We have different types of probes. Probes are handheld devices. Specifically, this ones we'll be focusing on. So we have Lumify, we have Butterfly, we have Mindray. Specifically for today's CME, we'll be having Mindray. So this is what it looks like. This is the Mindray probe. It comes with a case. So you just open the case and there you have your probe. So you take your probe, turn it on. Specifically, the Mindray one is waterproof. It has an IP68 rating. So yes, as depending on your practice and your specific needs, it's important to consider such things. Now, specifically, this probe is a wireless probe, so it doesn't have a wired connection. Um, Everything has its benefits and non-benefits. Using a handheld probe is easier. It's easier because you just need to be walking around with your probe, could be in your pocket. You go to the bedside of the patient, you turn it on, connect it to your phone, you have your ultrasound gel, and voila, you're able to see what's happening inside of your patient. Another advantage of this handheld probe is that it's significantly more affordable than the traditional standalone ultrasound machines. Cost for this one, cost for this one is 600, around 600,000 shillings. Of course, you can ask for a discount as a Kenyan, of course, yes. For the ultrasound machine, the cost is around 1.5 million. So, the handheld device, personally, I would recommend it. Of course, if you're scanning a lot of patients, then preferable to have a number of handheld devices or have an ultrasound machine. Because if you use this probe for too long, then it becomes hot. It overheats, which is a common issue across the board with all of these handheld probes. So yes, that's just good information to know. We have Butterfly, which is the least expensive, but based on our experience, is not the best. We have Mindray, which is the second most expensive. Mindray, relatively good, has good features. We have Philips Lumify, which is the most expensive, this one, this white one, which is 850,000 shillings. So if you prefer, Philips, you take this Lumify one and you're still happy. Yes. Yeah, so yes, POCUS is very nice. Here we have lung ultrasound ongoing, high quality CPR, etc. So we do have an ICU class next week. In case you're interested, we welcome you a lot. We know this April things have been difficult in our country, but all the same, we encourage you to continue pushing in. BLS, ACLS, we do have a class happening next week. The next POCUS training, we just had one end today. The next one will be in May. Yes. So having said that, I welcome you all a lot. In the recent past, we would give 10 CPD points to medical officers, but someone somewhere snitched on us. I don't know who that individual is, but I guess that's the nature of life. 5 CPD points is what we now get as medical officers. Nursing officers, we also get, or we are supposed to get 5 CPD points. There was someone who uploaded their certificate and they were issued three CBD points. I'm not sure why. I asked the nursing council and I'm still waiting for feedback. Clinical officers, this is where we're based. We request that you bring your logbooks for stamping so that we can stamp your logbook and you get your CPD points. Having said that, karibu sana. This is our website, our email address, and our Facebook page. I'd encourage you to follow us on these social media platforms as well. We usually post all of these skills. So lung ultrasound, cardiac ultrasound, the first exam, vascular access. We were doing triple A as well. So very exciting. Yes, so check us out over there. And yes, hopefully you learned something new from our posts. Otherwise, welcome so much. I want to take this opportunity to welcome Edna to take us through today's CME. In case you have any questions, please ask. Today we'll be focusing on probe use. Yes, any questions you may have as in regards to ultrasound. So, thanks so much, Edna. Most welcome.
Good afternoon, everyone. Welcome to today's CME. My name is Edna. We'll be taking you through probe use, just the basics. So when we're using this probe, we just want to learn POCUS, which is the point of care ultrasound. And basically why we do POCUS is not to replace radiology. We want to do it just to be able to answer some question. So it's a goal-directed something that we do. What you're trying to do is answer a binary question that is yes or no, whether we have any free fluid, yes or no, whether we have it, or other things that we can use the POCUS for is when we are doing resuscitation, we are trying to look for the heart contractility, for shock patients when we want to know what type of shock that the patient has, whether it's hypovolemic, is it cardiac, cardiogenic shock, whether it's we want to know whether it's obstructive shock. So those are the things that we are using for POCUS, just to be able to diagnose, to resuscitate our patients. Also, we want to be able to, we can use it for therapeutic purposes. For example, when we want to do pericardiocentesis, we use our POCUS. Those are the main reasons we want to use POCUS. Make diagnosis, therapeutic, resuscitation. Now, POCUS. When we are doing POCUS, we need to use a probe, and we can have the handheld probe like what I have right now, or we can have the machine, that's portable machine, which I find these to be easier because I can be with it anywhere. I don't have to be going with a big machine. So basically I need to know how to use it. as much as training is important today, I'll just take you through what is really happening with this probe. Now, ultrasound, as the name suggests, what we are using is sound. So humans, as we talk, when we communicate, whatever, what you can hear from me is sound. And that is sound that we can hear. And the sound is measured in wavelength or the cycles, that is the frequency. And the one that we can hear as human is approximately 16 hertz. Frequency is measured in hertz. So 16 hertz to around 20,000 hertz. That's what we can hear. That is sound. Animals do communicate. So when animals communicate, it's something that we can't hear, and that is infrasound. Now, what you're using in ultrasound is ultrasound, a lot of sound that we can't hear. And what is used in ultrasound is usually approximately from more than 20,000 kilohertz, more than 20 kilohertz. That is in the one that we are using is in megahertz. So we use from 2 to 5 megahertz. That's what we are using for ultrasound to be able to see our images. So with our probe, a probe has something we call the piezoelectric crystals, which are here. And what they do is they convert electrical energy to mechanical energy, which is now the sound. And using a medium, which we can use like a gel, that sound is sent to a tissue, and then listening is done, and feedback is given to the probe. And that is turned from mechanical to electrical, and it's translated on the screen, and that is now the image that we can see. So once that is done, what happens is we see images on our screen. And when we see images on our screen, let me just say what we see on our screen. We see different shades of gray. That's how I can describe it, something we call echogenicity. So when that sound is sent, different tissues will react differently in the body. So they can either absorb that sound, and when they absorb that sound, some will not send back any sound to the probe. So what we see when there's full absorption, we see black, which we call anechoic. And that one mostly we see it in fluid. Sometime the tissue decides to reflect. So the sound is sent, the tissue decides, let me reflect back everything that has been sent. And what we see on the screen is white, which we call hyperechoic. And mostly we see that with tissues like a bone or something that is quite stiff or can transmit. So everything is transmitted. So it uses like something we call an acoustic window. So what we see is isoechoic. So that is light gray, like the surrounding area. Or we can see some has been transmitted, some has been absorbed. So it's neither here, neither, it's not black, it's not gray, so it's dark gray that we call hypoechoic. For hypoechoic, they are structures like clots or fats. So those are the different shades of gray that we see on our screen. Now, how to use the probe? If you have like a probe like mine, so this one is the mind ray. So the next thing you need to have is you need to have a tablet or a phone where we can connect. So you need to have the app. So I have my app here. Then I'm going to connect my probe. So switch on and connect it. So you can use it either on your tablet, you can use it on your phone, as long as you have the app on your phone. So I'm connecting. So once you connect your, it's connecting. So once you connect your, it's been saying all that. Once you connect your probe, the next thing you want to choose is where you want to scan. So, do I want to scan the abdomen? Do I want to scan the cardiac? Do I want to scan the lung? So that's what we call the preset, where I want to scan. So even in the other ultrasound machine, you want to choose your preset. So for example, I can choose the abdomen, I can choose the cardiac, the lung, vascular. So I can use my probe for vascular access, thyroid, we have carotid, we have aorta, we have the deep vascular for the gyne, OBS, we have the musculoskeletal, we have all that. So you can choose your presets. Now, when you're choosing the presets, this will help us to focus more on that body parts that you are trying to scan. Once you've chosen your presets, now you can choose the probe. If you have the machine, they have different probes, and you can choose the appropriate probe for what you want to scan. So once you've chosen, the next thing you want to think about is your depth. And depth is here. So depth is how deep you want that to scan. As a beginner, you want to start with a deep depth, then you can reduce once you generated the image. The other thing is orientation. Now, in POCUS, in point of care ultrasound, orientation, mainly we do two orientation. We either do the longitudinal view, and longitudinal, what you're trying to cut, we are trying to cut in perpendicular. So in longitudinal view, we have our probe marker, and this is my probe marker facing the head of the patient. Or we can either choose the transverse view, where the transverse we are cutting across, we are separating between the superior and the inferior. And when we are doing the transverse view, we cut our probe marker should be facing the right of the patient. So when we are doing point of care ultrasound, those are the two main orientation that we have. So think about the depth, the orientation, and then gel. Now gel will be used as a medium. Sorry, so it's going to be used as a medium to be able to generate the image. So something else that I should mention about a probe, we have different types of probes. We have the linear probe, we have the curvilinear, we have the phased array, and we have the endocavitary. So the difference is the frequency. So we have frequency, we said in ultrasound, the frequency is between 2 to 5 megahertz. So frequency, it's how fast it goes. So for probes that have very high frequency, examples of those probes are the linear probes. The linear probes look like this. They are flat. So they have a very high frequency. And what that means is the resolution is going to be very good, but it will not penetrate more. So it's good to be able to scan the superficial areas like for vascular access or musculoskeletal. Then we have the curvilinear. The curvilinear looks like this, but it's curved. And curvilinear has a very high frequency, which means the resolution is a bit poor, but it has deep penetration. So that one mostly we use it when we are trying to scan the abdomen or deeper tissues. We have the phased array. Phased array is smaller and looks like curvilinear, but it's smaller. And that one mostly it's a low frequency probe. So it's going to have a poor resolution but penetrates deeper. And because it's small, it can go between the ribs, and that one mostly we use it for cardiac. Then we have the other one, which is the endocavitary. That one mostly we use for OBS or the transvaginal ultrasound. So those are the different probes that you can use. This one is looks like a linear, but it's a combination of a linear and a curvilinear due to the new technology. Also, for the new probes that we have, they come with a place, or the new technology is where we can change the frequency of the probe. So in case we want a higher frequency, we can change that and be able to scan maybe superficial areas. So those are the basics of probe use. I don't know whether there's any question. So in case there's any question, we can put it in the chat box, and we'll welcome Edgar to continue.
All right. Thank you, Edna, very much for that short but succinct. I learned a new word. There's someone who taught me the word succinct. It means short and straight to the point. Yes. Again, I would like to say thank you very much for everyone for making the time. We know that it's in the middle of the day and finding time is hard. We hope that the session has been insightful and has given you some new knowledge to work with. Hopefully somewhere, you can shine by asking, is that probe curvilinear or linear? And I'm like, oh, this guy knows about probes, man. But yes, if you'd want to learn more about probes and ultrasound, we do have another training. We just finished one today. The next one will be in May. In case you're interested, we welcome you so much to attend this one. During this training, you do scan a number of patients. So by the time you finish your training, you will have acquired a new skill that you can actually apply in the clinical setup. But the challenge we always have after the training is that you do have a new skill, but possibly you may not know how to apply it because you don't know about ultrasound machines, where you can get them, how much they are. Yeah, so you can ask us in case you really do not know about this world of POCUS, but you are interested in, equipping your facility or your center, or you just need to consult on matters concerning POCUS, we are here for you. Yes. Otherwise, have a great rest of your Thursday afternoon. CPD points will be shared on Monday. It is possible to share tomorrow, but let me just say Monday. Let me not overpromise. Yes, so CPD points will be shared on Monday. Medical officers, CPD claim card will be shared. Nursing officers, we request that you share your full names via WhatsApp, and then your certificate will be shared on Monday, which you can then upload and get your CPD points. Clinical officers, we request that you do bring your logbooks to where we are located at Fifth Avenue Suites in order to get your CPDs. We stamp your book and you're able to claim the CPDs. I forgot to mention, this month we've been having this April offer. We've been having this April offer. Not many people have been claiming it, and I'm not sure why. In order to claim the offer, remember, I've even forgotten the code, but I'll share it via email. If you're interested in training this month, remember to mention the code so that you can get the discount this month. Thanks so much, everyone. Does anybody have any questions before we conclude? All right. All right. Thanks so much, everyone. We'll be having another CME in after next week. We hope to see you in that one as well. Goodbye.